Shall we move? We'll move briefly on to the next topic, which is night terrors. And I appreciate we've dwelled for some time on the slightly negative side, but there is some optimism coming. I promise. Um, may I ask each of you what keeps you up at night, Miguel? When you wake up at 3 o'clock in the morning, what do you worry about? Not in your personal life. I'm talking more about the. Oh, unless you really want to share.
You know about that? Um, I think what probably worries me the most is making sure that I have an alignment between what I believe and what the others see and on what I say or what we say. Because it goes back to what Sven has said and I was saying is we should we should not be drinking on the Kool-Aid. I mean, like saying, yeah, it's fantastic. Our technology is enormous. Our value is so incredible. This will just happen. We need to work hard. We need to develop. So I'm always concerned that I am missing the point. I'm being self-servient, looking into too much inside. So that's what worry me. Because if I'm able to do it properly, I'm able to convey to the investor, to the stakeholders, to the patients, to the physicians at all the clinical trials, and eventually afterwards. So it's making sure that I attach to reality. Is probably what keeps me more worried most of the time.
Angela.
I don't usually wake up at 3 o'clock in the morning. I sleep really well. However, the things that one of the things that still worries me, that I really hope we can do something about, is at the risk of bringing up the B word. We're still suffering from Brexit. So in the UK, we have a manufacturing facility. We want to manufacture for Europe as well as for the UK. At the moment, we're stuck with that bureaucracy of having a double QP release because that's what Brexit gave to us, or it's at least what the UK government didn't negotiate well at Brexit. Um, with this kind of thawing of relationships between the UK and the EU, I really, really want to push the government to include that kind of harmonisation as part of their discussion. So it doesn't wake me up at night, but it really annoys me.
Thanks for the candid answer, Shane.
Well, as we're amongst friends, there's something I've been meaning to say. Um, I think what concerns me and worries me is that we are still, when I meet with a lot of companies, we're still kind of in that bubble that we do cell and gene therapy, and this is cool science that no one else can do. So, we need to be invested in. And I think what what I'd really like to get over today is investors don't invest in science. Investors invest in therapeutics. So what we want to see and what I desperately try and get from meetings is your science is great. You've been working on it for many years. You've bled it. I get that. It's wonderful. But I want to know the so what. How are you going to use that science to become a therapy to change a patient's life? That to me is the really important thing. And I worry that we haven't quite gotten that message yet. And so that's what I wake up screaming at 3:05 every morning.
Thank you very much.
And you know, that's a maturity of the system, right? We're still living on the inertia of the science, but we need to move to the reality of the commercial success.
Do you sense that changing though? That dynamic as we move forward. Everyone's growing up a little bit.
I think it is
Yeah.
probably slower than definitely what Sven would like, and I agree. But it is changing, and I made that point earlier on. I mean, 10 years ago we were talking about science. Today we're talking about patient access and making sure that all the pieces are there so that patients get treated, and that's twofold. It's our mission of delivering therapy to patients, and it's our mission of delivering back return on investment and a commercial viable proposition. So it is changing, but it is like a tanker. It's slow to move.
Maybe to echo Miguel's point, and I don't want to be harping on just developers. It's the broader macro environment. It's not just therapeutic developers, it's regulators, it's payers. We've been working, right at the beginning, we spent an inordinate amount of time educating regulators as to what are these cell things that we're using. In those days, it was mostly MSCs or chondrocytes or whatever. And we spent a lot of time educating them about that. I think we've kind of pulled back a bit. We haven't done a great job of continuing to partner with the regulators. Now, some of that might be down to headcount, capabilities, their ability to meet with us. But we need to work very hard at that education for the regulators, for the payers, help the payers to understand these therapies, what are the strengths and the weaknesses, and then coming to things like sickle cell disease, beta thalassemia, these kind of things. It's educating the patients. We need to do a better job of educating the patients, because if they don't know about these therapies, the good and the bad, because nothing is perfect, we're not going to have a sustainable business model. So we need to do a better job of getting out there and educating. And it is going slowly, but it is moving. I agree.